Hey, before we get started with today's episode, I want to let you know that if you're planning for retirement or aren't sure where to start, we have a helpful checklist for you. We put together a guide called Your Pre-Retirement Checklist and have made it available for free on our website. This detailed checklist covers things pertaining to cash flow, Social Security, Medicare, asset allocation, and living a purposeful retirement. The link to download the checklist is listed in the episode description. Or you can go to wiserinvestor.com, scroll to the bottom, enter your email address, and then you'll have access to your pre-retirement checklist. Thanks for listening.
Welcome to the Wiser Retirement Podcast. We believe the best financial advice should always be conflict-free. I'm your host, Casey Smith. Guiding you to financial freedom are my co-hosts, Brad Lyons and Barnett. Hey, guys.
Hi, Casey.
How's it going?
So today, we're going to talk about healthcare and retirement and what options you have. We have a lot of people retiring before 65 now, and there's nothing that I've seen that would push Medicare available to 60-year-olds or even 55-year-olds. So there's a bit of a gap. Like, what do you do between 55 or 60 and Medicare at age 65? And stay tuned, because our next podcast will go into Medicare and all the different parts. So if you're looking for that, wait for next week. But for now, it's a problem that we solve. So in financial planning, we solve for the worst case scenario, which is you go down to Humana or Blue Cross and you just sign up for a plan, right? And that's going to cost a family today about $21,000 a year,
Close to retirement, yeah.
Yeah. So now that $21,000 includes your premium. It also includes some copays. We give an allowance for copays and
certain deductibles. Obviously, like you said, that's present day though, and I think a lot of clients get a little bit of sticker shock when you inflate that out of the future about 5%, which is what healthcare is increasing at currently. So those numbers can get pretty large.
Yep. But again, we plan for it. Now, then there's the reality is that do you actually want to pay that much? And so there are some options that you have, maybe not necessarily cheaper options, but maybe better quality options. And we'll kind of outline that. I think number one is, if you're leaving an employer, does your employer offer retiree benefits? That'd be a no-brainer, right? We have a lot of people who work at utilities that we've worked with, and a place like, CobBMC or Southern Company, they are covering a lot of retiree benefits. Actually, it's a great benefit.
Usually a lot of companies that have pensions, teachers can get that if they've vested long enough. So, but that's still rare for a majority of Americans.
Yep. And if you do have that privilege, then you'd put your spouse on there as well. So that's a no-brainer. It's probably cheaper than any other option we could come up with. But again, you're right. Majority of Americans would not have that option. There are a couple of ways to qualify for Medicare. I did not know this until we started prepping for this podcast. There's really three ways. If you're on Social Security disability, and you've been on it for at least 24 months, you can qualify to be on Medicare before age 65. If you have ALS or Lou Gehrig's disease, you qualify, or ESRD, End-Stage Renal Disease. And as Brad said earlier, you probably wouldn't be able to see the fact that you could qualify, right?
Right.
Bad joke, Dad. Brad. Brad, it's a dad joke. But yeah, so that's very, very unlikely for most of the people that at least we come in contact with. But there are ways to qualify earlier for Medicare. After that, Matthews, what do you typically go to when you're talking to people?
Yeah, so obviously the option people know the most about because their employers provide them information is COBRA. And that's usually providing a gap for about 18 months after you would no longer be employed. One of the issues with COBRA is that they can charge 102% of your premium. So obviously when you're working, either you've subsidized some of that premium cost or your employer's paid all of it. So you would pay your employee, your employer part plus 2%. So that can be a very costly option and not ideal in retirement on a fixed budget. So obviously you see a lot of those. You could go through other providers, like I know we've talked about it in the past with Medi-Share or some of those faith-based programs. Mm-hmm. There's some pros and cons of those, as we've discussed and seen in the past, where The fact of that they aren't a legally binding contract as a insurance policy might be. So you just have to be careful for that.
Yeah, and Cobra, how long does Cobra last now?
Usually it's 18 months after separation.
That's right. Okay. And then the Medi-Share, I've seen a lot of people look at that, but you are correct. It's. I think if you're fairly healthy, it's probably fine. But if you have a major medical issue, I'd be a little nervous that they're going to cover all the costs. So
yeah, you've seen great stories about it and read about it, and I know 60 Minutes has done stories on this too. And but you've also seen the horror stories where it's those catastrophic events, which is really the main reason you need insurance coverage.
Yeah.
And it could be denied on certain claims just because, like I said, it's just not a legally binding contract as it would be under insurance because it's more of a faith-based.
Right. Okay. There's also short-term health insurance, which I'm not entirely sure if right now if Georgia is covered in that, but I know other states are, and that's where you basically it's a really high deductible policy that you'd have between your retirement and Medicare kicking in. So maybe it's a year or less. You could use that. That's an option. You can always Google that in your area, wherever you are. Hopefully you never have to use Medicaid, but you could go on state health care, right? Because you have less than, was it $16,000 or something a year in household income?
Right. Income based.
I would probably avoid that in Georgia for sure. I think this is easier now than it has been in the future, but you could do a part-time job that's offering some type of health benefits. But today you might be able to find that part-time job because people are having a hard time finding workers. But in the past, I think that was kind of like the unicorn. I just want to work 20 hours a week and get my health care.
Work remote now,
but yeah,
from the beach.
Yeah, exactly. Might be more options on that front. Then there's also the option of just going to what we talked about earlier, individual and family health care insurance. So that you're just going to sign up for a private policy, and it works just like your corporate policy, really.
It's just going to be expensive.
Yeah, but you probably find a quality plan, but you're going to pay a big premium for that, on a monthly basis. I think the probably the most important thing is that you plan for it. Other than I'm gonna retire and I'll figure out healthcare later, because it's such a big thing to tackle prior to 65. In fact, sometimes it keeps people from retiring. You could do a partial retirement. Maybe one spouse retires, but the other one, then goes on their healthcare. That's one way you can do it. Stagger the retirement. And if it's for a year, maybe that's worth it, and that's not that big a deal. But to go 10 years, paying $21,000 a year plus, then today's dollars plus you have to inflate that 5% every year. That's a big nut to tackle for most people.
And the one we haven't covered and what we hear the most of is Affordable Care Act, or Obamacare as it's known.
Right.
So the way those work is they are income based, so it's based on the federal poverty level. So the only problem is it's based on 100% of the federal poverty level all the way up to 400% of the poverty level. It's tiered at 150, 200, and then up to 400. But those are income based as well. So if your income was above those limits, you wouldn't get the subsidies. And then when you don't get the subsidies, it's basically the same marketplace as what you would get from a private insurer. So for 2022, a family of two, the premium would be about $18,310, or your income would be $18,310 as 100% minimum federal poverty level. For a family of one, it would be $13,590, and then a family of four would be $27,750. So that would be the minimum of the 100% poverty level. You would get full subsidies from the government, and insurance be extremely inexpensive. But based on that, obviously that's a lower income level there. It can go all the way up to 400% of that. So for a family of two, that would be a modified adjusted gross income of $73,240, which is a little more reasonable for retirees. And that's kind of why it's important to do some income planning in retirement, make sure we control that income so that they might be able to not only live the way they want, but also get some subsidies to keep their healthcare costs significantly down. The thing to notice is that this is based off modified adjusted gross income. So that's obviously just your adjusted gross income, but then they add in non-taxable interest from other things, as well as the non-taxable portion of Social Security. So you just got to make sure that you're doing the calculations right with modified adjusted gross incomes. A thing that changed last year with 2021 as well as 2022, it used to be based, if you went above that 400% threshold, it was a cliff. So you actually got zero subsidies. With the American Rescue Plan of last year, for last year and this year, if you're above the 400% poverty level, you can still get certain types of subsidies. And the premium's capped at 8.5% of your overall household income. So last year and this year, there are still some benefits for those pre-retirees, even if your income's a little higher. But unless they change that, it would still go back next year to that cliff. So you just got to figure out what your income is, if it makes sense. Maybe living off a little bit less those few years right after retirement, pre-65, so that you can get some of those big incentives from the government.
In tracking that, you have to be careful. Make sure you don't go over, because there could be income. You could have income from your employer for a partial year if you're retired. Then you do withdrawals from your IRA. That's where maybe pulling from your Roth temporarily, or even living off like savings or a brokerage account would help make sure that you stay underneath those thresholds. What's the do you have the premium? So there's full subsidy, right? And that's pretty low. That's hard to obtain and still be able to live.
Right. I mean, yeah, for family of two, that's $18,310.
Yeah. And then there's some people would pay $30, $40 a month, right? And then there's do you know what the maximum is?
It varies by state. If it's silver, bronze, gold plans, and then so obviously each state's different in those thresholds. So it's gonna be significantly less than the 20 grand. You might see some families where, like you said, it could be free. Some where it might be similar to what you've been paying through a group coverage just from your employee portion. So that wouldn't be a huge lifestyle change.
No, very true. Very true. Well, again, the important thing is that it's planned for, and there's a strategy that goes along with that. You know, and it's difficult because, you know, those are great years if you have lower income to also be doing conversions from your IRA to a Roth. But a lot of times we can't do that because we have to focus on keeping healthcare affordable for the retiree. So there's are many different options in that case. I think it kind of goes back to savings, right? You know, when you're saving for retirement, by default, you probably should put half of your money into pre-tax, half your money into Roth. So when you get into situations like this, you can pull from a different bucket. If you're a high income earner, then maybe you're doing everything pre-tax, but then you have additional money you can save. You put that into a brokerage account. So now you have your pre-tax in your brokerage account, which is only capital gains. Right?
Maybe Roth, backdoor Roth, after-tax contributions in your 401k.
Correct. So you want, as you're saving for retirement, in this case, you want to develop these different savings buckets so you can pull from different things at different times to hit whatever tax strategy you're trying to accomplish. And then obviously when you turn 72, that could be blown up by the RMDs from the IRAs. But at least at the beginning, you're trying to get started. And that gives a lot of options tax wise, because there's not a whole lot you can do. There's no golden goose when it comes to oh my gosh, I have all this income. Well, all your money was saved pre-tax in your 401k. So yeah,
it's a good problem to have, but sometimes not ways around it.
Correct. Just saved a little. If you saved a little bit differently along the way, then it helps you with things like this when it comes time. I think that covers all of our healthcare options. I think we covered that pretty well.
Mine is Medicare, which can be a beast. They don't make that easy.
No. Yes. So that's. I think we'll transition into that next week. And anyway, thanks for listening and good conversation, guys.
Thank you.
Thanks for listening to a Wiser Retirement podcast. We hope you enjoyed today's episode. Make sure to subscribe wherever you're listening, that way you don't miss any new episodes. We would also appreciate if you could leave a rating and review. If you have any questions about anything that was discussed today, head to wiserinvestor.com and reach out. We would love to hear from you. This episode was produced and edited by Lilton Moore.